and welcome. I'm Vinaya Deshpande and you're watching CNN News 18. Now let's begin the bulletin with some breaking news that's coming in. Now this is about the COVID surge in India. Now the Union Health Minister Mandaviya has told that he will be holding a meeting with all state health ministers virtually. It is likely to be held at 12 noon today, and this will discuss the rising caseload of COVID cases in India. Now remember, there is a fear of resurgence of COVID in the country. We have seen that in the last 24 hours alone, over 5,000 COVID cases have been reported from the country, and that is causing concern about resurgence or the fear of resurgence of COVID again. The active caseload right now in the country is over 25,587 cases, and recently there were 13 deaths that were reported, leading to the total death toll from India to 5,30,929. Now we are seeing that in Punjab alone there has been a 13 times increase in the positive cases in the last 3 weeks alone. Now this is crucial information that's coming in on the background of the fear of resurgence of COVID cases, because remember, COVID cases are increasing in the country. There is an advisory right now to take care. We have also seen that the Supreme Court has allowed the lawyers to work from home and to appear from home in view of the rising COVID cases. Delhi's COVID-19 positivity rate has already breached the 25% mark recently. To get us more information on this, I'm being joined by my colleague Shireen live on the broadcast. Shireen, so there is a concern about resurgence of COVID in the country. What are the measures that the Health Ministry is planning to put in place?
Well, the first and foremost is that even when the cases were in fact rising since past 2 weeks, we have seen how the Health Ministry has in fact written to all these 8 states. Remember, there are 8 states which are reporting over 5% positivity, weekly positivity rate, and hence they were told that they need to test, track and vaccinate. Also, they have been told that precaution dose is something that they need to ensure that on ground that is implemented and more people take the precaution dose. Now, apart from that, we have seen that in last 24 hours there have been in fact overall 5,000 cases of COVID that has been reported in past 24 hours itself, and the positivity rate overall weekly positivity rate is about 3%, but in some states like Delhi, Kerala, Maharashtra, the positivity rate is in fact over 10%. So that is of course a very concerning situation, and regarding that there is going to be a meeting likely at around afternoon where the Health Minister Mandaviya will in fact be holding this meeting with all the stakeholders, that include the health ministers of all the states, that includes the health secretaries also. In this particular meeting, there are going to be 2 agendas. What is really the situation on ground in each of the states, and what all measures can be taken on ground to ensure that the infection is contained. Apart from that, April 10th and April 11th is when a mock drill has been planned by the Health Ministry. The aim of the mock drill is basically to see how well equipped the hospitals in the country are. Remember, a similar exercise was done a few months back in January as well. Similarly, a mock drill is going to be done on April 10th and 11th, and that is why in this particular meeting the nitty-gritty will in fact be discussed with all the stakeholders, all the state health ministers, how they have to go about, what are the SOPs, and what are the measures that they need to take to ensure that the mock drill is successful. So these are the main 2 agendas with which the Health Minister will be meeting all the state health minister. But what is the silver lining at this point is that though the infection rate is in fact rising, but at the same time there is no hospitalization that has been reported. It is of course when we talk about XBB.1.5 and XBB.1.6, these are sub-variant of Omicron which is doing the rounds in India at the moment. They are in fact severely transmissible, but they are not, as far as the infection is concerned, they are not severe in nature, and hence no hospitalization or no mortality at the moment are reported. And that is why the Health Ministry is ensuring that the infection is contained, and all the measures are being taken by the health ministers, and that is why a meeting has been called today. It is going to be a virtual meeting.
Well, Shireen, just a few days ago, the Health Minister had said that there is no cause of concern right now, though we need to be alert. In view of the rising number of cases now, is there any change of stance by the government? And which exactly is this variant that is doing rounds? As you rightly informed that, this is not the kind of variant that has a very serious impact on health, but it is highly transmissible. So, two questions. Firstly, is there a change in stance by the health department now, and secondly, which exactly is this variant?
Well, firstly, the first question that you asked, whether there is going to be a change in the stance of the Health Ministry. As of now, there is no change in the stance. They have been maintaining that they are not going to make any of the protocols or guidelines mandatory. They are, of course, ensuring that all the state health ministers and all the state authorities ensure that these policies are implemented. The vaccination, the people, around 97% of the people have taken 2 doses of vaccines. But as far as the precaution dose is concerned, that is in fact stuck at 27% of the population. Only 27% of the population has taken the precaution dose. So of course that is something that this health ministry is asking all the states to encourage. At the moment there is no change in the stance, because the data that is we are seeing, the Omicron, as far as Omicron is concerned, it has in fact been in India since 2022, and we have not seen much hospitalization with Omicron. And the XBB.1.5 and XBB.1.6, which is doing the rounds right now, it is not severe in nature, though it is very transmissible as far as the infection is concerned, but it is not severe in nature, and hence there is not going to be much of a change in the stance of the health ministry. But all measures are being taken, all precautionary measures are being taken to ensure that the infection is contained. Now to the second question, which is this variant that is doing the round. This is the sub-variant of Omicron, which is XBB.1.1.5 and XBB.1.1.6. Like I mentioned earlier, they are very highly transmissible. A person can actually infect more than 100 people, but as far as the severity is concerned, it is not much severe in nature, and that is why we are not seeing much of hospitalization. In some cases, we are seeing that person who is infected with this subvariant is getting well in about 3 to 4 days. So that is, if we are being careful at home, the home remedies are being taken, and hence the person is getting cured, is what the health ministry has been saying.
Well, Shireen, thank you so much for that information. We will keep coming back to you for updates on that very important